Alison Neville.
Carla, how are you?
Good. How's it going?
Very good, very good.
Thanks for making some time to talk. Uh, so we're here because you're supporting the current petition, and you are a professional arts therapist.
Yes. Still fairly new, but yes, I'm an arts therapist in my second year, nearly at the end of my second year.
Okay. And so could you tell us who you're employed through?
Yes, I'm self-employed in my private practice. So all the work I do is through that. I do work primarily with NDIS participants. I'm a registered NDIS provider. And I have a partnership with Doveton College where I provide NDIS funded art therapy to students at Doveton College. And they provide me a room and referrals and that kind of stuff, but it still is my private practice. And I've got rooms at Eve Studio. And yeah, I'm also doing some training and also trying to establish a arts-based consultancy business as well.
Mm-hmm. Okay. And can you tell us about whether or how in your work with NDIS clients, how are you a mental health practitioner when you're in that role?
Yeah, so it's actually a complex relationship, but I do when it's framed in NDIS terms, because NDIS is about the disability and the function, not about the condition or what is considered the treatment. So there is a complex relationship there, but a lot of the participants that I work with, most of the participants I work with are in there because they've got a psychosocial disability, which is essentially, a significant mental health condition that's impacting their daily life. And also a lot of the people that I work with that are in there with other disabilities, also the disability can impact on their mental health as well. So there's lots of overlap in those areas. Yeah. Mm-hmm. And that distinction between health and disability is a complex one as well. Yeah.
Okay.
We're not going to that right now.
No, that's all right.
You know what I'm talking about? Yeah.
A lot of the people that you do work with are experiencing mental health issues. It sounds as
yeah, the majority.
Okay.
Yeah.
And so can you tell us a little bit more about the range of people that you work with?
Yeah, so as I said, most of the participants I work with are in there because of psychosocial disability. So they have complex PTSD or significant anxiety or depression or schizophrenia. I also work with quite a number who have autism spectrum disorder, and then a range of other disabilities such as Down syndrome or stroke or other acquired brain injuries, dementia. Mm-hmm. So yeah, a whole range of conditions, MS.
And so as an arts therapist, how do you work when you're working with someone?
Yeah, it really depends so much on the person. So the practice is, as I have no doubt others have said, it's emergent and responsive to the person that I'm working with, and it's also collaborative. So it's how we work together and what happens within our relationship and sessions together. So it does vary. I really do try and understand and respond to why they're coming to art therapy and what they want overall from those sessions. With NDIS, that's linked to what their NDIS goals are. But really, what does that mean for the person and for their life and what they want from it? And also, what do they bring to each session? And what's most important for them on that day, and being able to respond to that, and the collaborative parties being able to make suggestions and initiate things or invite things, ways of exploring that creatively or artistically or symbolically in some way. Yeah.
And it can be through lots of different art forms by the sound of it.
Yeah. The multimodality is one of my favourite things about it because my background wasn't as a visual artist. I've, been learning that along the way, but yeah, I love using visual art. Could be collage or paint or, pastels. It could be poetry, use lots of poetry. I've now ventured into songwriting, which I love, and plaster, digital animation, acting, movement, gesture, any kind of symbolic imagery, using sand play, whole range of things. Some people like exploring new things, sewing, just started hand sewing. So some people like learning a whole lot of new techniques, and that's part of the fun, and, exploring different things. And others are, more comfortable with particular art forms and going more deeply into their content with that one art form. Yeah.
So art therapy sounds like it's very adaptable.
Very adaptable and heaps of fun, to be honest. Yeah. Some of the content, of course, can go very deep and sometimes be, challenging for the person, and I can feel that pain. But there's also joy, even in those really difficult moments. There's so much joy in the practice. Yeah.
Mm-hmm.
Yeah.
So, Alisoun, can you describe for us in sort of broad terms some of the benefits that people talk to you about, like why they like art therapy?
Yeah. I've started asking that more formally now, and trying to create spaces in which people can really reflect on that for themselves without feeling like they have to please me and their answers or please anybody else, but to think really meaningfully about whether it is making a difference. I do think I'm accountable to whether it's making a difference for them or not. And yeah, a lot of the examples are consistent with what I feel myself to be most able to support, but sometimes really surprising in the way that plays out for that person, or how often that plays out for that person, and sometimes how quickly, So a lot of that is around, the technical art therapist language is emotional regulation, but actually being able to manage complex and difficult emotions, and be able to ground themselves and make those, bring those emotions to a state where they're, more tolerable on a day-to-day basis, and they're able to cope with them, really, and work productively with them. So, yeah, using art to do that, I think that's one of the really amazing things that art offers, is really different ways of doing that, and really, really effective ways of doing that. It can release emotions. The art forms can be a container and a holder of those emotions. It's something they can do when I'm not there, and that's one of the surprises sometimes, is how often people are doing things in between sessions and how powerful it can be. And then learning that awareness of how their own emotional swings can occur and how they can self-manage them using art is so empowering for people, and can really, really change their understanding of what's possible for them and how much control they can have over it. I'm not talking about miracles and that it's easy for everybody after 2 sessions, or, but sometimes it can make a huge difference in 2 sessions, and it can change people's lives. Yeah.
Fantastic. So finally, Alisoun, why is this campaign so important at this point in time, to have arts therapists recognised as mental health practitioners in the 2014 Victorian Mental Health Act?
For me, the most important thing is about giving people in the community choices, that we are trained, we have skills. We also have skills that are quite unique and offer something quite unique, and that there is a lot of evidence behind. It's consistent with all the, neuroscience and the whole, contemporary understandings of how we work and how our emotions and our bodies work together, and the relationship between that and mental health. So we've got that training, we've got those skills, we can support people. We might not be right for everybody, but we are right for some people, and people want to try us and want to manage their own health and want to have the right to make those choices about how they manage their mental health. So Yes, of course, we've got our interests as a profession, but for me, it's much more important about people having choice about how they manage their mental health. And when we're trained and qualified and an existing workforce that people want to be able to access, why would we make those choices for them?
Fantastic. So on that note, we'll say thank you very much for your time, and the word choice about how we manage our own mental health is what I'm taking from the conversation. So thanks, Alisoun.
Absolutely. Thank you. Cheers.
Right.